So friends, let me explain it with the help of this fetal skull and this pelvis, bony pelvis, and then I will explain with the help of the dummy. Now these diameters are clear to you. This is the occiput and this is the sinciput. So I am describing according to the left occipito transverse position. So this is towards the left side and this is towards the right side. Okay. So this side of the pelvis is the left side because I am standing like this. Okay. And this will be the right side. So this is left occipito-transverse. This is in the transverse diameter. So with the uterine contractions, okay, first of all, the mechanism of labor is the engagement, and engagement I have already discussed. Then with the uterine contraction, there is descent and flexion occurring together, and occiput goes down till it touches the pelvic floor at the level of ischial spine. Ischial spine, I have already told you, this is what is the ischial spine. This particular part is the ischial spine, this one, and the important diameter is this bispinous diameter, which is this diameter, that is the 10.5 centimeters. Okay, so any fetal skull diameter, engaging diameter which is less than 10.5 will deliver. Okay, so this is the fetal skull in the transverse diameter, and this is the occiput towards the left side. This sagittal suture is like this. So there is engagement which has already taken place, and then with the uterine contraction there is descent and flexion occurring till the occiput touches the pelvic floor at the level of ischial spine. There is internal rotation of the fetal head, so that occiput comes to lie behind the symphysis pubis. Now the sagittal suture has come to lie in the anteroposterior diameter. So occiput lies behind the symphysis pubis and the sagittal suture has come to lie in the anteroposterior diameter of the maternal pelvis. So just imagine if imagine my head as the fetal skull, and if the occiput rotates like this, there is so much of torsion in my neck. Fetal neck cannot sustain that much of torsion because there is internal rotation to 2/8 of a circle. Okay, so that to relieve the torsion, there is automatically the shoulders of the baby rotates to 1/8 of a circle, and it lies in the oblique diameter. Still 1/8 of a torsion is left in the fetal neck. Okay, then occiput stretches the perineal outlet. This is called as crowning. Crowning is when the fetal head comes and do not go back. Head or the fetal skull was in the flexed attitude, so head is borne by extension, where there is delivery of the occiput, then delivery of the vertex, then delivery of the brow, and then finally the delivery of the face. Okay, so there is occiput, vertex, delivery of the brow, and delivery of the face occurs. Then there is dropping of the fetal head towards the maternal pelvis. This is called as restitution. And then there is external rotation of the fetal head. Same way towards the left of the maternal pelvis. Okay, why this occurs? Because the fetal shoulders were in the oblique diameter. So shoulder has the rotation of the shoulders occurs. To 1/8 of a circle. Now the shoulders come to lie in the anteroposterior diameter. So rest of the body. So first of all, when the head is born, there is delivery of the anterior shoulder, then the posterior shoulder, and rest of the body is delivered by lateral flexion. If you see, this is the occiput. Occiput comes to lie in the transverse diameter, then there is descent, flexion and internal rotation, so that occiput lies behind the symphysis pubis, crowning, and then head is borne by extension. Then there is restitution, external rotation, and then internal rotation of the shoulders, which come to lie in the anteroposterior diameter. Then anterior shoulder is born, posterior shoulder is born, and rest of the baby is delivered by lateral flexion. So engagement, descent, flexion, occiput touching the pelvic floor at the level of ischial spine, internal rotation, crowning, head is borne by extension, restitution, external rotation, followed by internal rotation of the shoulders, and rest of the body is delivered by lateral flexion. So hope you like the video, and this video is going to be useful for your preparation. I will bring up more and more explanatory videos for your exams in the final year, or if you are doing your MBBS, these sessions are going to be useful, or you're writing the PG entrance, it is going to be helpful. Thank you very much.